Hello and welcome to Nutrition and Healthy Eating. This is session 6. Now, the last 5 weeks of Nutrition and Healthy Eating has actually been laying the foundations to this particular session. So let's explore the role of nutrition, diet in the etiology, prevention and management of disease, such as cardiovascular disease, diabetes and cancer. Now, there's a saying, and the saying goes, when the diet is wrong, medicine is of no use. When the diet is right, medicine is of no need. Now, although we should take this with a grain of salt, it does illustrate the role that nutrition and disease have with one another. Both nutrition and disease are so tightly interlinked, it's actually quite difficult to separate the two. We're going to dive into this in a lot more depth right now. All right, so let's look at some relationships between macronutrients and chronic disease and how they can contribute to particular chronic diseases. An imbalance of these macronutrients can actually increase the risk of a number of diseases. So let's look at a few examples. So an increased consumption of kilojoules, energy, so that's either protein, carbs, and fat, can result in obesity. Surprise, surprise. An increased consumption of simple carbohydrates. So remember, simple carbohydrates are things like refined sugar and refined grains, where they have an effect on our glycemic index. These simple carbohydrates can go on and result in obesity and metabolic syndrome. Metabolic syndrome is a group of clinical signs and symptoms such as elevated fasting blood glucose, hypertension, high cholesterol, and so forth. And the prevalence of this metabolic syndrome is actually increasing here in Australia. Simple carbohydrate consumption can actually increase the risk of type 2 diabetes. Now we're going to be focusing on type 2 diabetes quite a lot in this session. Type 2 diabetes is an environmental condition, whereas the environment, which is our diet, can actually have an effect on type 2 diabetes. Another element in which simple carbohydrates can have an effect is on cholesterol. Now, believe it or not, the consumption of simple carbohydrates, such as lollies, sugar, and chocolate, and so forth, can have a greater effect on our LDL cholesterol, so our bad cholesterol, than the actual consumption of cholesterol within our diet. Increased consumption of protein can result in an increased risk of cardiovascular disease, kidney disease, high cholesterol, and even some cancers, especially colon cancers. Reduced consumption of dietary fibers, can actually result in an increase of risk of cancer, especially intestinal cancers. It can increase, a reduced consumption of dietary fibers can actually result in an increased risk of cancers, obesity, metabolic syndrome, type 2 diabetes. Why? We've kind of discussed this when we spoke about the macronutrients, and that is these dietary fibers support the bacteria within our gut, and also it helps to balance out the sugar within our system. It can also bind on to cholesterol to reduce that cholesterol. Now, a reduced consumption of omega-3, which is a polyunsaturated fatty acid, can result in inflammatory conditions, cancers, and cardiovascular disease. Omega-3 is viewed as one of the most potent anti-inflammatory compounds we have within our diet. So when there's less consumption of omega-3, then there is that increased risk of inflammatory conditions. Let's look at a few more examples, focusing more so on micronutrients. Now, an insufficient or excess amount of particular micronutrients can actually increase the risk of a number of chronic diseases. Now, some of these levels, or let's say therapeutic effects of these micronutrients, are the result of a therapeutic level of these micronutrients. Yes, some of these examples can be achieved using dietary levels of these micronutrients. However, in some instances, supplementation of these micronutrients are required to have this therapeutic effect. So let's look at a few of these examples. The first one is low vitamin D. Increases the risk of autoimmune disease conditions. Now, as we learnt about vitamin D when we spoke about the micronutrients, vitamin D helps to regulate the immune system. Autoimmune diseases or autoimmune conditions are a result of an immune dysregulation. Now, I see this in my own personal clinical practice. I focus on autoimmune conditions. Now, I actually become a lot more busier during the end of winter because a number of my clients will have a flare-up of their autoimmune conditions. Why? Because vitamin D is obtained from the sun, and during the winter months, especially here in lower New South Wales, there isn't sufficient vitamin D from the sun, so this UVB radiation, to actually sustain our vitamin D levels. And when there's low vitamin D levels, that can actually increase this autoimmune disease picture. Okay, high sodium can actually increase blood pressure, which goes on to increase the risk of cardiovascular disease. Low calcium, especially low calcium in the early years of life, up until about that 20-25, where our bone mass is still developing. This low calcium consumption in the early years in life can actually increase osteoporosis later on in life. Even low calcium after menopause or after the age of 50, 60 can actually exacerbate the osteoporosis because there's inadequate calcium to sustain bone mass. Now, zinc supplementation has actually been used for the treatment of type 2 diabetes. Zinc can actually help to release insulin from beta cells within the pancreas, and then thereby help with type 2 diabetes. So there's just a few examples of how these micronutrients can have an effect on these chronic diseases. So the question you ask me now is, Brad, what is a chronic disease? Well, it's a serious medical condition that lasts, or is predicted to last, for a longer period of time, generally around or above that 6-month period. Anything less than that could be categorized as an acute condition. Now, unfortunately, 4 out of every 5 Australians are affected by at least one chronic disease. Now, major causes of death and disability worldwide is the result of these chronic diseases. So it's quite interesting. You can actually get this thing called clustering. So when someone is prone or let's say diagnosed with a chronic disease, then what can actually happen is there's this clustering effect where they don't just have one chronic disease, they actually develop 2, 3, 4, or 5 different chronic diseases as a result of potentially the first chronic disease. So as an example, someone may get type 2 diabetes, which leads on to particular cardiovascular diseases such as heart disease, stroke, and even kidney diseases. Other chronic diseases, so when I use the term chronic diseases, I'm referring to a large group of these particular conditions. I may be referring to cardiovascular disease, type 2 diabetes, autoimmune conditions such as rheumatoid arthritis, which is an autoimmune disease affecting your joints, and you get quite severe swelling and immune complexes within the joints. You've also got inflammatory bowel disease, such as Crohn's disease, ulcerative colitis, type 1 diabetes. We'll discuss the difference between type 1 and type 2 diabetes later on in this session. Other chronic diseases may include particular cancers, osteoarthritis, which is the degeneration of cartilage within joints, or even osteoporosis, as we mentioned earlier, which is affecting the bone mass. And lastly, kidney disease. So what are some of these risk factors for chronic disease? Now, isn't this surprising? Let's go back. Isn't this surprising? Look at this. Lifestyle factors, including diet, accounts for 50%, that is 50% of the risk factors for these chronic diseases. Other contributing factors to chronic diseases are, yes, the human biology. Yep, right here. In environmental factors. Even medical care can be an element or a risk factor for chronic disease. There's a Latin term known as iatrogenic. That is, the illness is caused by the medical examination or treatment, which can actually result in chronic diseases. But the point that I'd like to really stress and get a point is 50% of risk factors are lifestyle factors, which of course includes diet. So you've got things called non-modifiable risk factors. That are particular factors which are associated with chronic diseases, but you can't actually change. Now, the first example is age. You can't change age, and thereby it's a non-modifiable risk factor, right? As you age, the risk of developing particular chronic diseases increase. Particular race can actually increase the risk of cardiovascular disease, especially those Aboriginal or Torres Strait Islanders, Asian descent and Indian descent as well, can have that increased risk of cardiovascular disease. Gender. Okay, one element I'll point out is women are more likely to develop an autoimmune disease than men. Another one is men and menopausal women are more likely to develop heart disease. So that's gender as a non-modifiable risk factor. You've also got a family history. Part of this, I believe, can be contributed to lifestyle factors, as generally we take on or adopt the lifestyle habits and factors of our family history, so our mother and our father. We eat what they eat and so forth. But generally speaking, family history is a non-modifiable risk factor because you are unable to control for it. So what are the modifiable risk factors? There are many, and we're going to be coming back to this quite frequently throughout this session. You've got things called your behavioral risk factors. What are things that you do, such as smoking? Yes, smoking will increase your risk of which chronic disease? I'm going to say lung disease. You've got alcohol use, poor nutrition, physical inactivity. These are factors that we can change, and then thereby change the odds and risk of developing chronic diseases. These particular behavioral factors can then go on as a result of an increased blood pressure. It can increase excessive weight, can increase blood cholesterol, which then goes on to contribute to chronic disease. Now this is an interesting one. Okay, just bear in mind, this is from that 2001, 2002 era. Unfortunately, I was trying to find an updated version of this. There isn't one such available, so I'm actually going to add in where research has changed in the last 20 years. So down along this column, you've got all of these chronic diseases, and across up here we've got particular risk factors as well, and whether or not they go hand in hand. So let's look at heart disease. So poor diet, physical inactivity, tobacco use, alcohol use. All of these factors can and are risk factors for heart disease. So there are a few that I want to add in here. We've got depression. Okay, in the last 20 years, the amount of research to support that diet is actually a risk factor for depression. So I'll put a tick in there. Another element that I would like to potentially add in here is asthma. All right, although previously thought it wasn't, poor diet can actually be a contributing factor to asthma. And then in addition, where is it? Osteoarthritis. So that is the breakdown of cartilage within our joints. It most commonly happens within our hips and within our knees. Now, this doesn't happen overnight. This happens over a 10, 20 year, 30 year period. And there are a number of factors at play, particular nutrients which will actually prevent the breakdown of this cartilage. So I'm actually going to say that poor diet is a risk factor for osteoarthritis. One element that I'd like to point out here is you've got osteoporosis. Okay. Now, you would think excessive weight would be a contributing factor to osteoporosis. However, it's not. That's because individuals who are heavier, especially in those earlier years in life, there's more pressure on the bones, and then thereby bones are actually stronger. So a healthy weight does support with osteoporosis. However, there's been research to say that potentially those who are heavier in the younger years could actually be a protective factor for osteoporosis later on in life. Okay, so similar to the previous slide, but a different way of showing this information of how particular risk factors can contribute to chronic diseases. First of all, let's look at cardiovascular disease right here. All of these risk factors, except for smoking, contribute to, and smoking, might I say, contribute to cardiovascular disease. The main factor that contributes to lung disease is, of course, smoking. However, let's come down here and see what we'd like to focus on is diet. Contributes as a risk factor for cardiovascular disease, cancer, and of course diabetes, whether that be type 1, type 2, or gestational diabetes. So you can see that these risk factors, they're all interlinked, and addressing these 1, 2, 3, 4, 5, 6, we'll say 6 or 7 risk factors can actually reduce the risk of chronic disease later on in life. Okay, so what are the treatment recommendations for chronic disease? There are a number of considerations that we would like to address for the prevention and the management of these chronic diseases. Broadly speaking, there's about 5 main factors that we'd want to address. And we're going to go through these and I'll give more details. The first one is to reduce inflammation. It is without doubt that inflammation is a driving factor in modern disease. Inflammation is elevated in autoimmune disease conditions, cardiovascular disease, cancers, osteoarthritis. Inflammation is one of these factors that we want to assess for and we want to control for. And what better way to reduce inflammation than our good old friend omega-3. Omega-3 is a polyunsaturated fatty acid which is anti-inflammatory and thereby can actually be used to reduce inflammation. And it's quite effectively consumed within our diet. If we eat oily fish, that supplies quite a large amount of omega-3 and then thereby reduces inflammation, which is one of these let's say, considerations we want to look at when we're speaking of chronic disease. Now, the next one I'll mention is to support the microbiome. The microbiome is your gut bacteria, especially within your large intestines. Now, research, probably more than just 20 years, probably in the last 30 years, we've actually almost demonstrated that the health of the bacteria within our gut can actually influence chronic disease. Now, there's this concept called the 1,000-day theory, where the first 1,000 days of existence, from conception to about the age of 2, those first 1,000 days can actually influence the diseases that we get later on in life. And one of those influential factors is the bacteria within our gut. We'll speak about this in a lot more detail when we talk about pregnancy and infancy care during our next lecture. Now, what are some of these ways we can actually support the bacteria within our gut or the microorganisms? What better methods than dietary fiber and resistant starch? As we learn, these two foods, these dietary fiber and resistant starch, they are or can be contributed to prebiotics. So they are food for the bacteria. So bacteria requires fiber and resistant starch to thrive, and thereby to support with chronic disease, we may want to support with the bacteria within our gut using dietary fiber and resistant starch. Another element is to support glucose metabolism. Glucose metabolism, it's an important one, especially when we're talking about things like insulin resistance. That is when our body becomes resistant to insulin. So insulin is a hormone. It's a messenger that tells the cells in our body to let glucose in. When an individual has insulin resistance, that message isn't getting across. Thereby, glucose isn't getting into the cell, the body requires more insulin, there's more glucose within our blood, not necessarily in our cells. Ways to support with that is zinc. As I mentioned before, zinc supports with the release of insulin from the beta cells within the pancreas, but it also directly supports with insulin resistance. So consuming a diet high in zinc can be beneficial for glucose metabolism. The other element is dietary fiber. Now, dietary fiber can help control what we spoke about when we spoke about macronutrients, is your glycemic index or your glycemic load. That is the effect that sugar and glucose has on our blood sugar and glucose. So when we consume dietary fiber, it slows down the release, and then thereby we have a more balanced release of glucose within our system, and then there we won't get this insulin resistance. Other elements to take into account when looking at chronic disease is nutrient absorption. Just because you take it doesn't necessarily mean you will absorb it. An example of this is Crohn's disease. Crohn's disease is an autoimmune disease affecting your small and large intestines. And basically there's a lot of inflammation within the intestines, there's ulcerations within the intestines, and then thereby absorption can't occur. Other elements or other conditions, you'll be thinking of celiac disease, another autoimmune disease affecting the villi within the small intestines. So to actually support digestive health right there. The other element, and this is quite broad, is to assess nutrient deficiencies. And how do we do that? We test and we treat accordingly. So we test for vitamin D, we test for B12, we test for other vitamins and minerals which may be low or high, and make the necessary recommendations to correct them. Okay, so let's review these 4 chronic diseases: obesity, cardiovascular disease, type 2 diabetes, and diet-related cancers. We're going to start off looking at the prevalence of these diseases, and then we're going to be looking at risk factors, and then potentially some methods on how to control them from a nutritional perspective. We've seen this slide quite a few times already. This is your BMI classification. So as we have discussed previously, there are, let's say there's 4 major classifications of BMI. You have underweight, healthy weight, overweight, and obesity. So for the purpose of nutrition and healthy eating at UTS, there's no need to, at this current time, remember that there's class 1, class 2, class 3, just that anything over a BMI of 30 is classified as being obese. You will need to know that right there. So just know that as obesity. Overweight and obesity worldwide prevalence. Okay, so the worldwide prevalence of obesity has nearly tripled between 1975 and 2016. Tripled. That is a lot. In 2016, more than 1.9 billion adults were overweight. Of these, okay, so they were overweight, and then another of these portion, 650 million were obese. That is a lot of fat in our society. Now, it is estimated that 41 million children under the age of 5 are overweight or obese. Over 340 million children and adolescents between the ages of 5 and 19 were overweight or obese. And this number isn't reducing, this number is increasing. So let's look at some Australian data. So data from 2017-2018, this is the most recent data that we have available to us. 2/3, that is 67% of Australian adults were overweight or obese, which was an increase from the 2014-2015 survey. Almost 1/4, so that's 24, we'll say 25% of children aged between that 5 and 17 years old were overweight or obese in this 2017-2018 period. Okay, what is the cause and effect of obesity? So, as you might already know, there are a number of causative factors for obesity. First and foremost, diet. Diet is a major causative factor of obesity, especially the overconsumption of kilojoules. In addition to this, physical inactivity, so not exercising enough, can increase or be a causative factor for obesity. Other environmental factors, socioeconomic status, and genetics as well. So you've got obesity, right? But what is the effect of obesity? So obesity can result in, we alluded to this earlier, insulin resistance and type 2 diabetes. It can contribute to a particular hormonal condition which is quite prevalent among young females, is this polycystic ovarian syndrome or polycystic ovarian disease. There is a very high percentage of young females that have this PCOS/PCOS. Bearing in mind, you don't necessarily have to be obese or overweight to result in an increased risk of polycystic ovarian disease. Cardiovascular disease. Now here's a fun fact for you. It is estimated that every 1 kilo of extra body fat you carry, there is an additional 11 kilometers of blood vessels. Isn't that incredible? So that just goes to show that when you have obesity and you gain weight, you put on kilos and kilos of body fat, and for every kilo of this body fat, we've got to get nutrients to these cells. And within that 1 kilo, we'll say about yay big, there's 11 kilometers. 11 kilometers of blood vessels. That's a lot of blood vessels. And thereby, our heart has actually got to pump harder to actually pump the blood through all of those blood vessels. So why is obesity a problem? As we alluded to just before, that there are a number of effects due to obesity, but we'll go over these again. So cardiovascular disease, especially heart disease and stroke, were actually a leading cause of death in 2012. Diabetes, musculoskeletal disorders such as osteoarthritis when someone is obese, they can result in osteoarthritis, generally of the hips or knees. Now, I find this one quite interesting. Childhood obesity is associated with a higher chance of obesity, premature death, and disability in adulthood. So it is very important to address this risk of obesity during childhood, and we'll discuss this in a moment. And the moment is here. Okay, so first of all, there are a number of ways that we can address this obesity epidemic. Okay, we can address it on an individual level. That would include things like limiting the amount of energy intake, so limiting the amount of food, especially from fats and sugar. Increase fruit and vegetable consumption, such as legumes, whole grains, nuts, as a dietary intervention. To engage in regular physical activity. On a community level, to make the community supportive. Okay, examples of this is potentially easier access to healthier food options. Tax on sugar and sweetened drinks. Just a few examples. From a food industry level, the food industry, they actually have a major factor, they are a major causative factor for obesity. I guarantee you that they could actually reduce the amount of fat, sugar, and salt in their foods, and it will still taste just as nice. So reducing those fats, sugar, and salts could be a method which we could actually reduce this obesity epidemic which is among us. Making sure that there's accessible, healthy, and nutritious food choices, affordable as well. Restricting marketing of food high in sugar, salts, and fats, especially in and around the afternoon when children are more likely to be watching TV. All right, so let's talk a little bit about cardiovascular disease. So cardiovascular disease, it's a term to describe heart disease, stroke, blood vessel disease such as heart attack, you've got heart pain, high blood pressure, clotting, and so forth. Now, we can see from the image here, this is plaque. This yellow right here, this is plaque. Now, what happens when plaque builds up? It can actually cause a narrowing of our blood vessels. And when there's a narrowing of our blood vessels, our heart actually pumps harder and our blood pressure will actually go up. This is referred to as atherosclerosis. A bit of a tongue twister there. And we'll discuss this in more depth soon. Okay? The prevalence of cardiovascular disease. So in 2014, 2015, within Australia, there was 4.2, that is 22%, had one or more cardiovascular diseases. So it could be heart disease, stroke, angina, and so forth. Hypertension right here. Okay, 1 in 3 deaths were due to cardiovascular disease in 2015. Now, unfortunately, Indigenous Australians had cardiovascular disease hospitalization and death rates at twice the rate as non-Indigenous Australians. So Indigenous Australian could be categorised as potential subgroups of our community which are at increased risk of cardiovascular disease. So looking at the prevalence of cardiovascular disease in New South Wales. Now let's see, everyone can find where they live. I'm up on the northern Sydney up here. So there is a low prevalence of cardiovascular disease. However, if you move out towards, let's say, southwest Sydney, and then also the Blue Mountain area, there's actually a high prevalence of cardiovascular disease. So let's look at some of these risk factors for cardiovascular disease. The most important behavioural risk factor of heart disease and stroke is an unhealthy diet, physical inactivity, tobacco use, and the harmful use of alcohol. Without a doubt, they are the factors most at play here. The effects of behavioural risk factors may show up in individuals as a result of increased blood pressure, increase in glucose levels in our blood, increased lipids, and obesity. Simply by stopping the use of tobacco, reducing salt in the diet, consuming fruit and vegetables, and regularly performing physical activities, avoiding alcohol, have actually been shown to reduce the risk of cardiovascular disease. Cholesterol. Oh, this is a good topic. Now, the two greatest factors affecting cholesterol are exercise and sugar. I'll allude to this in a moment. So a bit of a background. You've got two types of cholesterol. You've got your HDL cholesterol and your LDL cholesterol. Your HDL cholesterol is commonly referred to as your good cholesterol, whereas your LDL cholesterol is generally referred to as your bad cholesterol. Now, there are two different types of cholesterols. When we do a blood test for total cholesterol, this measures both of them and can actually be an inaccurate marker of cholesterol status. I'll explain why. So this HDL cholesterol, one of its roles in the body is to actually move cholesterol from your arteries, from your blood vessels, back to the liver to be processed. Okay? Whereas LDL cholesterol will actually move cholesterol from the liver to the arteries, causing this buildup of plaque. Now, I said that the two greatest factors affecting cholesterol were exercise and sugar. Okay? Exercise increases your HDL cholesterol, your good cholesterol, right? Whereas sugar, your simple carbohydrates, can actually increase your LDL cholesterol. It is a common misconception about, let's say, cholesterol within food. Now, if you reduced all cholesterol in your diet from butters and milks and so forth, you'd be able to reduce your cholesterol within your body by about 11 to 13%. Okay? Not much. The rest of the cholesterol is actually made within the body. Our body makes cholesterol from byproducts derived from simple carbohydrates. So the sugar that you're putting in your coffee, that potentially can go on to get formed into cholesterol. Wow. All right, another element closely related to cholesterol is your triglycerides. So triglycerides are the end product of fat digestion. So when we consume fat, we break it down into triglycerides. Okay. High levels of triglycerides in the bloodstream is actually linked to heart disease and stroke. These triglyceride levels should and are only checked after an overnight fast. You see, when we consume a meal, even if it has a small amount of fat within it, these triglycerides will enter in our blood vessels, and thereby, if we get our bloods checked after eating, then it will appear that our triglycerides are high. So it's important that when triglycerides are measured, that they're measured after an overnight fast. That is, no eating and only drinking water from the time you go to bed until the time you get the blood checked in the morning, generally about that 8 o'clock. Now, diets high in carbohydrates, so above that 60% energy and alcohol, increases triglycerides. So it's not just fat that increases triglycerides, it's carbohydrates, alcohol, and fats. And that's how the cholesterol is related to this triglyceride as well. Now, look at this. Triglycerides can actually be reduced by consuming omega-3. Look at that, omega-3. And of course, exercise. Here are the levels of triglycerides in our body. There we go. The normal range or low risk of cardiovascular disease is generally below that 1.7 nanomoles per liter right here. So how do we reduce the burden of cardiovascular disease? From an individual level, there are two elements. You've got lifestyle factors and diet. Look at this, healthy weight, being physically active. It is almost common sense that these are elements that we can implement to reduce the burden of cardiovascular disease. From a diet's perspective, increasing dietary fiber. Why? Dietary fiber supports with the bacteria in our gut. Dietary fiber supports with the health of the large intestines by producing what we refer to as short-chain fatty acids. You've also got, it helps to regulate your glucose control. So that's dietary fiber. The next one is antioxidants. We discussed a few antioxidants, such as vitamin C and vitamin E. Last but not least, omega-3 can support via reducing inflammation, via reducing triglycerides, and so forth. From a population level, controlling tobacco use. Maybe we could implement a taxation to reduce high fat and high sugar foods. That's been something in debate in the news in the recent years, and whether or not that would actually result in a reduced prevalence and incidence of cardiovascular disease. We may support with the activity level right here by building walking paths and cycling paths. Strategies to reduce alcohol intake. Maybe even providing healthy meals at school. So then children at school are getting a balanced diet, and then thereby reduced risk of obesity, and thereby a reduced risk of cardiovascular disease. All right, we're moving on to diabetes. Now, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin, or when the body can't effectively use insulin that it produces. There are three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease, and generally the onset is earlier on in life. However, individuals can get diagnosed with diabetes in their 20s and 30s, this type 1 diabetes. And that is an autoimmune disease where the pancreas, the beta cells, will actually be attacked by our own immune system, and the body won't actually produce insulin. Thereby, an individual with type 1 diabetes will require to use insulin synthetically as an injection to maintain their levels. Secondly, you've got type 2 diabetes. type 2 diabetes is diabetes as a consequence of our environment. So it's generally the onset of type 2 diabetes is generally later on in life. However, we're actually trending towards it becoming midlife where we actually get diagnosed with type 2 diabetes. And that is diet related and exercise, don't get me wrong. You've also got gestational diabetes. Now, this is diabetes where it's diagnosed during pregnancy. So we're going to be focusing on type 2 diabetes. So what happens, or what is the consequence of type 2 diabetes? There's quite a lot. So we've actually got, it can affect our lower limbs. We can have peripheral neuropathy, that is a loss of sensation within our lower limbs due to damaging of the nerves. We can have what we call a diabetic foot, and that is ulceration. And you can actually see this in a few older adults. They've got quite a red, sore looking foot, and that could be potentially contributed to diabetes, or let's say uncontrolled diabetes. Adults with diabetes have a 2 to 3-fold increased risk of heart attack and stroke. So that's affecting the heart. A combined reduced blood flow and then also neuropathy, so this nerve damage, can result in this diabetic foot. Diabetes is among the leading cause of kidney disease. Doesn't look fun to develop type 2 diabetes. Let's look at the prevalence of type 2 diabetes. An estimated 1.2 million, that is 60% of Australian adults aged over 18 had diabetes. Yeah. Let's look at the difference in gender. Men have got a higher prevalence of diabetes in comparison to women. Now, if we look at this, around twice as high in low socioeconomic groups. So those who are in that low socioeconomic group, men, prevalence 10%, women 7%. So it's still that same. Men have got that higher rate of type 2 diabetes in comparison to women. However, if you look at the higher socioeconomic groups, it's 4% each. So it's actually lower than that total reported in Australia. Now, this is a big one. I put a little flag next to this one right here. Indigenous Australians were almost 4 times, that is 4 times as likely to have diabetes in comparison to non-Indigenous individuals. So not only are Indigenous Australians at a greater risk of type 2 diabetes, we've also seen that they're at a greater risk of cardiovascular disease. Let's look at some of the risk factors for type 2 diabetes. Family history of diabetes, whether it be type 2 or even gestational diabetes, less so type 1, but more so this type 2 diabetes. Older adults, okay, over the age of 55. However, if you are overweight, then that age reduces to 45. Being over the age of 45 and high blood pressure as well. But then look at this. Individuals who are over 35 years of age and who are Aboriginal or Torres Strait Islander background have got that risk factor for type 2 diabetes. Women who gave birth to a child of 4.5 kilos, risk factor, or had gestational diabetes when pregnant, or had this polycystic ovarian syndrome. Those of individuals with a PCOS are at a greater risk of type 2 diabetes because both of their pathophysiology, let's say the contributing factors, are a result of insulin resistance. Reducing the burden of type 2 diabetes. Look at this. Maintaining a healthy body weight. How do you do that? Be physically active. Here's a tip for you. So during insulin resistance, our body can't effectively bring in glucose into the cells and thereby process it, and that glucose stays within our blood vessels, and if it stays in there, then that can cause nerve damage and so forth. Now, actually exercising after a meal may reduce that. You see, when we exercise, we've got these receptors called GLUT4 receptors within our intestines, and within our cells. Okay, during exercising, these GLUT4 receptors open up. So if we actually exercise after we eat, we can actually bring in glucose into our cells without the use of insulin. So it's a great way to address insulin resistance, or let's say to reduce the risk of type 2 diabetes. Irrespective of when you exercise, at least 30 minutes of exercise every single day. Eating a healthy diet, avoiding sugar and avoiding saturated fats. Yes, that is a prevention method that can be done. Avoiding tobacco use. Now, early diagnosis and lifestyle interventions is a must when it comes around to type 2 diabetes. Simply a screening of your fasting glucose can be a screening factor to diagnose type 2 diabetes. And if we know that there is this early stage or pre-diabetes, pre-type 2 diabetes, then we can implement some of these lifestyle and dietary factors to reduce that risk. Let's look at cancer, diet-related cancer. Worldwide, it's been estimated that 374,000 cancer deaths each year are the result of low fruit and vegetable intake. Not smoking, not lack of exercise, low fruit and vegetable intake. Now let's put this into perspective. Although the coronavirus is developing every single day, as of today, this rate of death is twice as high in comparison to the death rate of coronavirus. Although, yes, coronavirus will continue to rise until it reduces, I just want to put that into perspective that there is a vast number of deaths that we could prevent if we address fruit and vegetable intake from a dietary perspective. Look at this. In between 2011 and 2012, only 5% of Australian adults had adequate intake of fruit and vegetable. Not many. We can actually reduce the risk of colorectal cancer by increasing dietary fiber. So this is from canceraustralia.gov.au, looking at the evidence for protective factors and risk factors for different types of cancers. Dietary fiber as a protective factor for colorectal cancer, so that is, your small and large intestines. There is convincing evidence to support that dietary fiber is protective for colon cancers. Okay, another convincing factor here, risk factor, red meat and processed meat. There is convincing evidence that red meat and processed meat are risk factors for colon cancer. Just focus on those two rather than the others for this slide. Reducing the risk of diet-related cancer. Okay, there are two factors at play, two major factors when it comes around to reducing the risk of diet-related cancers. The first one is dietary fiber. To meet that suggested dietary target for fiber intake. Now, this may include increasing unprocessed cereal grains, so whole grains, legumes, and aiming for 5 servings of vegetables and 2 servings of fruit each day. So that is one major factor for reducing diet-related cancers, especially colon cancers. Now here's a big one. Limit intake of red meat to less than 500 grams per week and avoid processed meat. Now in 2015, the World Health Organization, they came out and they estimate that every 50-gram portion of processed meat eaten each day increases the risk of colon cancer by 18%. So if colon cancer is in the family, it would be strongly advised to avoid processed meat and limit other red meats while increasing dietary fiber. Other factors at play here is to limit salt intake and processed foods, to drink less exercise, to maintain a balanced energy intake to prevent weight gain, and of course to move every single day, 30 minutes a day. Okay, this brings us to the end of the lecture for session 6. I hope you've enjoyed this, and I will see you next time.